はい。では、今日はですね、スペシャルインタビュー第2弾で、スノーアジアでですね、三浦先生が、ラビ先生に、お話を伺ってきましたので、前回の続きのお話をですね、皆さんにお聞きいただきたいと思います。それではどうぞ。
So, okay, in 2023, it was a very important year for us genitourinary medical oncologists. The many new drugs
Yes.
are emerging to the genitourinary cancer, Belzutifan and Erdafitinib and EV+pembro. So, what do you think? Is there any concern about the toxicity profile of those drugs, especially in Asian population?
Yeah, thank you, Yuji. I think it's a very important question. As you rightly mentioned, these are all new classes. There's antibody drug conjugates like EV302. We have had some experience in Asia because it has been approved in the third line and beyond in many countries and even reimbursed. There is obviously some concern about the toxicities because the clinical trial seem to show these drugs are relatively well tolerated.
Yeah.
But anecdotally, we get information from oncologists, urologists who have used this drug in Asia that they do find many of the patients requiring dose reductions with EV.
Yeah.
So I think what is important is all of us in Asia should collaborate, maybe form a registry or database and look at our own Asian data
Yeah.
and not just look at subgroup analysis from clinical trials where the patients are fitter than real world, and it may not be representative of what a true patient may experience. Similarly, with Belzutifan, I think many countries in Asia do not have access outside of clinical trials. So I think we are still learning. There are, of course, concerns with anemia and hypoxia, which are unique to Belzutifan.
Yeah.
But I think, again, we need to use the drug here and learn about it and combine our data to see how Asians tolerate it. Because in LightSpark 005, it's still a relatively small study, and I think we have much to learn about the drug and its impact in Asians. And Erdafitinib has been around for a while, but in the advanced setting, not many patients harbor FGFR alterations. And in fact, anecdotally, again, I think people in the region say it's more closer to 10% rather than 20% seen in clinical trials. So I would urge investigators in the region to collaborate, form Asian consortiums to gather all this data so we get more data for our own patient population.
Thank you. So I hope that we will have the Asian collaboration and the Asian registry, the consortium like the IMDC. I will have more collaboration with you and within the Asian countries. Thank you so much for coming to this program today.
Thank you, Yuji.
Thank you.
はい。三浦先生、ありがとうございました。
はい
ラビ先生との、仲の良さが伺えるいい話だったと思います。
ありがとうございます。
今後先生、アジアでの、
はい
オリジナルの臨床試験、あるいは治験っていうことを、
はい
企画していかなきゃダメなのかなというようにも捉えられたんですけども、先生、そのあたり、
そうですね。
どうですかね。
はい。実は、他の領域、肺がんとかではですね、結構そのアジアでの新薬の治験とか、臨床試験とかやっているので、そういうのも、一つの方法だと思いますし、ただ、なかなかハードルが高いっていうのも現実なので、ラビが言ってたようにですね、レジストリ試験みたいな、例えば、その、アジアン IMDC みたいなのを作って、そこでアジアのデータを出していくとかですね、そういったものも楽しいかなって、それもハードルは高いんですけれども、できたらいいなというふうには思いました。
ありがとうございます。これ非常に意義のあることですので、ぜひ、実現に向けて、ラビと先生とで、
はい
頑張っていただきたいと思います。
はい。
はい。それでは今回はこの辺で失礼します。次回をお楽しみに。